So I will invite Dr. Josef Scheiber, just introduced, the founder and managing director of BioVariance, as well as Dr. Steffen Schmidt, project manager, healthcare IT in the Medical Valley, Nuremberg. Welcome to the stage.
So, by the way, I love the music. Thank you for being here, Josef and Steffen. We both, I got to know Josef today, but I know him from different presentations and talks. I know Steffen about 15 years ago or something. Yeah. With Steffen and also with Josef, we tried to establish a chapter for Hacking Health in Munich, by the way. Everybody is invited to join us. We will join on December 5 here in Munich. You can see the location, if we know it, on the website of Over and Partner. That's for the beginning, but now thank you to stay with us this night, Steffen and Josef. I'm really happy to have you here. I prepared some questions, but of course, please feel free to interrupt us, to send us questions on Slido. Steffen, let's begin with you. You are one of the leading project manager for Medical Valley, a cluster in the near of Nuremberg, or the Nuremberg metropolitan area in Erlangen. A very important cluster for Bavaria. You, well, let's say, care about startups. Can you say
other things, yes.
Okay. Can you say something about your job? You can do that better than me.
Yeah, thank you, Thomas, for your introductory remarks. Maybe some few words, some introductory remarks on Medical Valley, and then on what I'm doing there. As you mentioned, Medical Valley is a cluster management organization for medical technology and healthcare. And the initial goal and the aim of Medical Valley is to assemble all players in healthcare, so from healthcare industry, from healthcare providers, and of course also from the research environment, to join them together in the sake of developing innovative products, services and solutions for the healthcare system. Medical Valley actually dates back to the middle of the 90s, but in the way that we exist today as a registered association. Medical Valley exists since 2007, and our big progress and breakthrough event actually was that we won in 2010 the award of Cluster of Excellence. There was a competition by the Federal Ministry of Research and Education, and we were awarded as the national cluster for medical technology. At Medical Valley, we have a joint strategy, and this joint strategy of all actors and all players active in the Medical Valley is that we only embark on things that improve the effectivity and efficiency of healthcare. So either by lowering costs or by rising quality, or in the best case, doing both things simultaneously. My job at Medical Valley is to take care of all our projects, our initiatives in the field of healthcare IT, and I'm also happy that I'm not only doing this at the Medical Valley most recently, I'm also, and we as Medical Valley, we are involved in a new project of the Bavarian state government. It's called the Zentrum Digitalisierung Bayern, with the office here in Munich or in Garching, and it's part of the digital strategy of the Bavarian state government. And we as Medical Valley are involved there and are responsible for the field of healthcare.
I see again the really important things in digital transformation happens in Munich and Bavaria, not in Berlin. So you are working for Medical Valley since several years?
I've been working there for now, exactly 4 years actually.
Okay, so you saw a lot of startups, successful as well as unsuccessful maybe. So what's your opinion about digital transformation in healthcare in Germany? Especially compared to other countries, maybe in Europe or also to the US?
To start positive, it could be worse. but we are far from really good anyway. It's funny. I've just came back from Denmark some days ago. I was there attending an e-health session as well, and we were discussing about how to learn from each other. And Denmark, I don't know if anybody of you knows, but if you go to typical healthcare events, Denmark is always seen and considered as the promised land of healthcare, especially of digital healthcare. But so I was quite relieved that when we had the discussion in Denmark some days ago, also there in Denmark there's much room for improvement. So if they have the same issues, if you go to a hospital in Copenhagen and you're a patient there, and some years later you are hospitalized in a hospital in Aarhus, for example, they don't know about your patient file and your patient history either. So not only in Germany but also in other European countries there's room for improvement. But anyway, to get back to your initial question, in Germany, I think we are right now at a very exciting point, because we can see a growing awareness of the importance of healthcare IT. It's still work in progress. If you have a look on hospitals and on doctors' offices, we are right now, in my eyes, far from a digital standard. So talking to some doctors, some general practitioners, in their eyes, Health 4.0 is still using the latest version of the telefax. But I don't want to be rude, and it always has a reason why we are so much behind, also in international comparison. And one reason in my eyes is we have definitely a lack of standards. So there's this very fragmented environment. We have this problem of different healthcare sectors, outpatient, inpatient sector. And if you talk to international colleagues, they always ask you, what's this thing with different sectors in healthcare and what are the problems that arise with that? So there are many basic structures or some basic problems that don't go directly back to healthcare IT, but to the healthcare system structures. And so, it's no surprise that today many things are still paper-based in hospitals, in nursing homes, and at general practitioners on the one hand, and on the other hand we are already talking about really cool stuff like augmented reality. We've seen that in the presentation before. I think it's far ahead from it's far away from healthcare today, but we are already talking about augmented reality. We're talking about cognitive computing. Our follow-up presentation will be about Watson, as far as I know, and Watson is doing the first steps with ruin clinics in Germany. So there is, on the one hand, we are far behind. On the other hand, we are talking about very futuristic things. But there's a gap in between, and there's a lot of homework to do, in my eyes, for the German healthcare players. Finding standards, bringing Wi-Fi and so on to hospitals.
That's true. Thank you for that detailed view on the market. You said we have a lot of room for improvement, but on the other hand, we have the success stories, and one is sitting next to us. Josef, thank you for being here again. As far as I know, you began your career in the pharmaceutical sector, and in 2013 you founded your company BioVariance, but much better than me, you can explain what you do, what your company is doing. So would you please introduce yourself and your company?
Okay, thank you very much for the opportunity to discuss here, Thomas. So basically, where to start best? So when I started my first job, this is now almost exactly 10 years ago, this was in Big Pharma, and there always the problem was we don't have enough data. So this was in a drug discovery, we don't have enough data, we want to understand side effects better and so on. But always the problem was we don't have enough data. And within the last few years, there was a real revolution in the pharmaceutical sector in terms of data generation. For example, 10 years ago, sequencing a human genome costed around $400 million. Nowadays, you pay about around 1,000 euros. So the consequence of this was a total change in this kind of model that now we have way too much data. So it's easy to produce masses and masses of healthcare data. This is on the molecular level. now talking about the different sensors you showed nicely in your talk, this even adds another layer. But just amassing data doesn't really bring us further. So we need to make sense and learn from this data to come up with decisions, to make the right decisions based on the data we are amassing. And this is the area we are active in. So basically trying to make sense out of this complex biomedical data to then enable proper decisions. On the one hand, working with pharma companies, they are well aware of that, and this works nicely. But still, within the healthcare system, in terms of data usage, there is, particularly in Germany, still a long way to go. There is much more opportunity than what is currently done with the data that could be collected and analyzed.
Okay, thank you. Could you please explain what you do with the data and what your clients are doing with the data and the results of your work? I said in my presentation, I guess the goal is to make medicine more precise and more personalized. Yeah. Is that behind that?
Yes, absolutely. So now, for example, in a clinical study, you can go in and track a lot more information about the patient over the time they are taking a medication, for example. So a very simple example would be just take the pulse rate from the patient all the time when they are taking a new medication. So you see if it affects it somehow. This is a simple and more or less made up example now. But really finding those details that make a drug basically problematic for some people, but making it a great drug for other people. And the whole picture of a patient. So also in the pharma, there was this the tendency to have the blockbuster drugs. So you have one drug that cures everything for everyone. But of course, those drugs don't work for 100% of the patient. Depending on the disease, you are lucky if it works for half of the people, which means half of the people are taking drugs that don't work for them, but still might cause some side effects. But now we have the data to understand for whom these side effects happen and for whom not. So, and if you then put in a diagnostic test first and identify the right patient, then you can be much more convinced that this is going to work. So this is...
Okay, okay, I understood this. Let's have a look on the questions from the audience. I would prefer the second one at first. What are the biggest challenges with digital health in Germany? Is it privacy and big data? That's a question for you. What about big data and privacy and data protection?
Yeah, so I always like this quote from Professor Lehrach in Berlin. So in Germany, more people die due to data privacy than data privacy is protecting people. So we have to draw a clear line where it does make sense and where not. So analyzing the data without looking into personal data should, in my opinion, not be really... of course, you need to extract the personal information to not be able to follow it down to the single patient. But analyzing the huge amounts of data to find new hints towards better application of treatments or medicine, there should be a way better access for the big data. But still, now, technically this would be no problem. We rather have the problem that most of the data, as Steffen already mentioned, is still on paper. So, for example, we did a small project with a company to basically extract data from letters written from physicians to make it digital again and then to automatically analyze that stuff. So there are much more structural basic issues before you can talk about the real big data application. The data you currently get in the German healthcare system is no big data. This is, but if done properly, and the standards you mentioned, Steffen, if this would be applied properly, there would be a very straightforward way without getting in trouble with personal privacy, but still having the availability of analyzing large amounts of data for the benefits of individual patients again.
Well, that's interesting. I think I think a lot of politicians should talk with you and not with lawyers about that topic, because
Yeah, of course.
I think it's more purposeful. We have two other good questions. The first one, will apps replace the doctor, the Hausarzt, as we say in German? And the other one, how do those healthcare app providers try to convince the doctors that the healthcare app is really a good one? So, Steffen, I think two questions for you.
Yeah, thank you. These are really good questions, and I think they are quite connected, because it's always about how bringing the solution to the doctor and what does it mean for the doctor. There are many skepticals. As a doctor, will I be replaced, and what is my future role? And perhaps, first of all, I try to answer why are so many doctors skeptical, and not only doctors, but also patients. I think it's very a really huge job that politics has to do is to deliver more information to show the potentials of healthcare IT, because there are many dark spots and people don't know about the potentials, about the chances, and they only are afraid of the risks. So, and this is also why many physicians are skeptical. And moreover, they are also skeptical because, in my eyes, they think, oh, not again, another IT solution. Of course, there have been IT solutions for outpatients, for general practitioners and hospitals, but to be perfectly honest, there also have been a lot of crappy solutions. They are not user-focused, they don't hit the user's needs, and many of these solutions that are still in application today, they don't create a benefit. They are more seen as a burden or a hurdle for doctors, for nurses also, and this makes them very skeptical. And regarding the second question, will I be replaced as a Hausarzt, or to draw this a bit further, as a doctor, as a medical doctor in general? Well, if you're not open, I think there might definitely be the chance or the risk of being replaced. But on the other hand, I would consider all this whole process of digitalization in healthcare, I would consider it as a chance to redefine your role as a healthcare provider. I think many people who decided to do a job in healthcare, they did that because they explicitly didn't want to deal with documentation, with computers, with all these things, but instead they wanted to help the people. They wanted to work with people, and I think digital solutions are a great opportunity to make healthcare processes more efficient and to win more time to really do what you wanted, to care about the patient. And perhaps one remark: it's not only the Hausarzt. If you think a step further, there will be one kind of medical doctor that can be or that could be replaced, in my eyes, in a few years, and this is the typical radiologist, because tools like IBM Watson Health, they will be definitely capable of analyzing pictures better than the human eye. So there is definitely a need for medical doctors to redefine their role model, to redefine their job description if they don't want to be replaced. But then again, it's a chance. It's not a risk.
I think we have to mention another aspect. We see this very often through the eyes of people who live in Munich, Berlin, Hamburg, Frankfurt, or anywhere in the big cities. We have a lot of regions also in Germany where you have no doctors, so there is nobody who can be replaced. So and digital services in healthcare could help these regions a lot, I think.
Totally. Nice you mentioned it. I have a best practice or a worst practice, you can decide, from one of our Medical Valley projects. We means a partner. We have assembled a group of partners from research, from a startup company, and from a pharmacy group in a very rural area of Bavaria. And there was definitely, or still is, a lack of healthcare in this region. And they developed an app that makes the workflow and the processes in the pharmacy definitely more efficient. The pharmacy is now able to deliver the medication to the patient at home and so on. So it's a really cool solution, and it helps people to get their drugs, their medication earlier. And now this whole project has to face a lot of criticism, because somebody, we don't know who actually, but somebody tries to accuse this group. They are not, they don't fit with German law, because they are accused that their app directly forwards the prescription from the doctor, from the medical doctor, to the pharmacy, and this is not allowed. If this does make any sense in areas like this, well, we can discuss it separately. But the fact is, it's just a workflow app. It definitely improves the healthcare provision. It improves the patient life. But there are a lot of people who try to attack these innovations, because their stakes in danger.
Okay. Yeah. Good to know. So we have to come to an end. But we have another favorite question. How will big data affect psychiatric work and psychological research? And I think, Josef, you have a project in this area.
Yes, exactly. And it's actually through Medical Valley, so that's the good thing. So we are working with the University Clinic for Psychiatry in Würzburg. And so the point is, I think the first part where it will affect psychiatric work will be in treatment selection. So patients, usually finding the right drugs and drug combination and doses for people in the area of psychiatric diseases takes half a year or longer in complicated cases. But there are plenty of studies that you can enhance and shorten the time frame for the benefit of the patient, because you bypass side effects, etc., by leveraging genetic data of the patient, because there are, let's say, 7 billion genomes on that planet here, and every single genome deals differently with drugs. But there is the standard system how drugs are metabolized in a human. You can analyze that pretty well nowadays. So what we are going to do in this project is to take 1,000 patients, analyze the genomic data, and in parallel measure the drug levels over several weeks, and also how the patients feel. And there are several studies in the literature that once you have the data and once you apply then machine learning to be able to predict the best possible combination and dosage of drugs from the genetic background, you can shorten the time frame from half a year for finding the right treatment down to a week or two. And this, on the one hand, is of course a big benefit for the patient, because they suffer less. There is less cost involved for the insurances. The physicians need to invest less time in finding the right combinations. They can target way more precise. And now always the point comes, but pharma companies, what about them? And they are also happy, because their drugs are not associated with side effects that might trigger a market withdrawal or some other problem. So if this is done properly, and this is now, I'm at the moment only talking about optimizing treatment, there will be a significant impact by leveraging the data in the right way. Of course, you can also then think about certain diagnostic work, but for this, there are recent studies that you need to assemble more data than is currently available. And this opens up a whole other can of worms, but the first big impact by leveraging big data will be in finding quicker the right treatment for the patients.
Thank you, Josef. Another very interesting statement. Thank you. We have some other questions, and I'm sorry that we have to stop here. Time is running out. But we have the latest question. Would you say digital change is just starting here in the healthcare sector now? With an answer, just yes or no. Steffen?
Yes.
Yes. It's hard. Yeah, I know.
It's difficult. So
we are at the beginning, probably.
We are at the beginning. It's slower than elsewhere, but we managed to start already.
Okay. Good answer. Thank you a lot for your attention. Thank you for the chance to be here and discuss with you. And I think we can say hello to the next guest.
Thank you. Thank you. Thank you very much.